Hello and welcome to Anatomy Coloring Book, page 60. This is Dr. Stephen Harkins. This lesson we discuss the muscles of the posterior thigh. We've discussed already the hamstrings and how they insert into the iliotibial tract. We used a highlighter. This is that sort of tendinous material, very tough and durable and powerful and stretchy. You can see also the tensor fasciae lata muscle on the front here, inserting into the iliotibial tract as well. The gluteus medius, the gluteus minimus. But when we think of the posterior thigh, we think of the hamstrings. You've all heard of the hamstrings muscles, starting with the semimembranosus right here. There are three hamstring muscles. Semimembranosus is right in here, mostly called semimembranosus relative to its partner, the semitendinosus, which has a longer tendon. So it has a relatively shorter tendon and it's more fleshy. And so they call it the semimembranosus instead of the semitendinosus. And its origin is at the ischial tuberosity. You can see right up here, the semimembranosus, this broader, flatter of the hamstring muscles. And you can see how it is originating at the ischial tuberosity with its partner hamstring muscles. So the hamstrings originated the ischial tuberosity of the pelvis and inserts right here on the back of the tibial condyle. It comes around and it's deeper than its muscles that have been cut away. This is all the same muscle here. Deep, and this comes underneath the tendon of the biceps, or the semitendinosus, and attaches on the posterior medial tibial condyle. Then we have the semitendinosus muscle, which lies on top of the semimembranosus. And it is aptly named because it has this long tendon right down in here. There you go. Which wraps around, here it is, cut off. Here's the cut away so you can see the semimembranosus. But the semitendinosus, yes, is characterized by this long tendon. This is the tendon you can actually feel on the back of your leg, on the back inside of your leg. It's this tendon right here when you flex your leg backward. You can actually feel it popping out. So it's called the semitendinosus. And then wrapping around to the front of the tibia, or the medial part of the tibia, at a place called the pes anserines. Here it is, the pes anserinus. It is a spot, and is not diagrammed anywhere here, on the medial or inside of the knee, of the tibia, of the tibial plateau. And it's a place where that tendon meets two other tendons as well, which we'll talk about later, the sartorius tendon and the gracilis tendon. The last of the hamstrings is the biceps femoris. It's this muscle right here, more on the lateral side of the hamstrings, the lateral side of the posterior thigh. And here you see it coming down and around, and it's got a long tendon as well. And it too originates on the ischial tuberosity, and here it is, it's been cut. And here it is, touching up again. It actually has two heads. Got this head here, the long head, which reaches all the way up to the ischial tuberosity. And the short head, let's keep it the same color. Short head, which originates on the posterior femur. And the insertion of the biceps femoris is on the lateral portion of the head of the fibula. So the biceps femoris has two heads to it. A short head originating from the femur, the linea aspera of the femur, and the long head, which originates from the ischial tuberosity. And then they join together at the tendon here and attach at the head and insert at the head of the fibula. So here's your origin, your insertion down here. What's the action? Well, the action of these, let me actually finish drawing the semimembranosus, part of which was hidden. Oops. Yes. Down behind the semitendinosus. And the action is to flex the knee joint. Here you see the flexion of the knee joint. That's bringing the lower leg closer to the thigh. That's flexion, bringing the angle down, shrinking the angle, sort of bringing your heel to your butt, as it were. Flexion of the leg at the knee joint. They also extend, because of their attachment here at the ischial tuberosity, they also are capable of some extension of the thigh at the hip joint. So it's sort of a reverse pull. The origin becomes down here and the insertion becomes up here. Actually, that's not accurate. The origin stays here and the insertion is down here. But it extends the thigh at the hip joint while it also flexes the knee over here, flexes the leg at the knee joint. So because it crosses two joints, the hamstrings cross the knee joint and they cross the hip joint by their attachment here. They are able to act on those two joints by flexing the knee and extending the hip joint. Now, having said that, they also have another job too. The hamstrings, the semitendinosus and the semimembranosus, because of their attachment on the medial side of the tibia here, if you'll notice right here, will medially or internally rotate the leg. So they would bring the toe inward. When the knee is bent, they can bring this toe inward to the medial side because they're attached to the medial femur down here, or the medial tibia down here. Now the biceps femoris, because it is on the lateral side here and attaching to the proximal, the head of the fibula, when the leg is bent, will do the opposite. Will laterally rotate and bring the foot outward when it is flexing the knee as well. So semitendinosus, semimembranosus, flex the knee, flex the leg at the knee, and also rotate the foot inward, whereas the biceps femoris will flex and rotate the foot outward. And in the diagrams above, you can see an example of tight hamstrings because of their attachment at the tibial or at the ischial tuberosity. If they're tight, will keep the pelvis, will block the pelvis from flexing forward and keep you from touching your toes. Here's an example of tight hamstrings actually pulling the pelvis backward and rotating it backward into what's called a hypolordotic, or a straightening of the back, whereas hamstrings that are normal will allow the pelvis to rotate anterior and create a lordosis curve in the back. And this diagram here is showing the powerful glute max, which is a powerful extender of the hips, of the femur at the hip joint, and as well as the role of the hamstrings in extending the hip joint as well. Showing somebody deadlifting and doing some power cleans here. And when the glute and the hamstrings will do is straighten, kick the knees backwards into extension and allow that weight to be raised. You can see why the hamstrings are extensors of the hip joint. You can see here why they're flexors, because if this biceps femoris muscle pulls up, the leg will come with it. If this semimembranosus pulls up, the leg will come with it. On the other hand, it's got an origin here at the ischial tuberosity, and so if it pulls this way, it'll also pull the entire leg up at the hip joint. If these muscles pull up, yes, they'll flex the leg, but they'll also pull up here and extend the hip as well. And that marks the end of lesson page 60 of Anatomy Coloring Book, The Muscles of the Posterior Thigh. This is Dr. Stephen Harkins.